Report.
Classes resume across Connecticut soon, but is our state ready? Jeff Flax of Hartford Healthcare is with us today. He is the president and CEO of the organization. And Jeff, good to see you back here in the program.
Thank you, Dennis. Good morning.
Good morning to you. So the numbers continue to trend in the right direction. Why do you think Connecticut has been successful, and you look at other states that are really hot spots right now?
Dennis, I don't believe there's any coincidences. I think from the beginning, the alignment with our state government, the leadership from Governor Lamont, the coordination of all the health systems across the state, and most importantly, the culture of the state, people coming together, standing together, following the right practices. I think we've taken the right actions at the right times, and by and large, it's really proven to create, thank God, favorable results.
So parents are home watching right now, and perhaps they're thinking, like, should I send my child back to school? Should I do a hybrid thing? Is it going to be safe? What do you think from what you know so far about this?
I fully appreciate what a difficult decision that is, and in many cases, the fear that people have. I think the fear is very real. I can't speak to the specifics around every school district. There's always going to be unique situations around different buildings and different resources and measures that can be taken. But what I can speak to, Dennis, with confidence, is we released yesterday a study within Hartford Healthcare that began in May and the first phase completed about a week ago, where we did antibody testing on nearly 7,000 members of Hartford Healthcare, many of which worked on the front lines throughout this crisis. And when we looked at the results, it showed that about 6.4% of the people who were enrolled in the study tested positive for antibodies, which is nearly identical to the broader testing done in the state of Connecticut. So what it demonstrates is when we follow the precautions, when we use personal protective equipment and use it properly and follow the procedures that have been put in place, we really can demonstrate that in high-risk environments that we can provide a safe set of circumstances.
What are your medical authorities and your doctors at Hartford Healthcare telling you about a potential vaccine?
We're very engaged in the vaccine discussions. Some of our members of our team are working at a research level. There's a lot of energy around it. There's a lot of optimism. And as you've seen at the federal level, there have been some very significant investments made with several companies around pre-purchasing hundreds of millions of dollars of dosages. So, we're hopeful. And we're hopeful that with the amount of investment that's been put in place and the incentives that we're going to see some point into the near future, these phase 3 studies advance, and ultimately that this becomes available to our communities.
There are some people who say, oh, it's COVID, you get some sniffles, I'll be fine. If I get it, I'm going to be okay. But then you hear these other stories of people who've had kidney failure and liver problems and even heart failure, and you've been on ventilators. So what do you say to people who perhaps are lackadaisical about protecting themselves?
Vigilance, absolute vigilance. People need to wear a mask, hand hygiene, proper social distancing, being attentive to the travel guidelines. We're not only protecting ourselves, our family, the people who are most important to us, we're protecting the community as a whole. This disease has been deadly for many people. It has created very significant sickness and illness and thousands of hospitalizations. So it needs to be taken extremely seriously.
What is next for the hospital industry? Do you see it? Has it started to come back at all?
Dennis, we're living and really successfully working through an environment where we are having COVID positive patients we're treating, and we're testing people to the tens of thousands daily. And at the same time, we're treating now nearly at our pre-COVID levels for all of our services, from surgeries to major interventional procedures to physician office visits, to radiology studies, and everything in between. So I'm really thankful. It's important, Dennis, we note that during this COVID crisis, one of the other really contributing factors was that people were avoiding care, and it was really creating either people getting much sicker than they needed to, and in some instances, even deaths that could have been prevented or severe disability.
Good to see it coming back. All right, Jeff Flax from Hartford Healthcare, we thank you so much for joining us today.
Thank you, Dennis.
Have a great rest of the summer. When we come back, Lieutenant Governor Susan Bysowitz is with us. We welcome your comments on Facebook, Instagram, or Twitter. You can find me on all 3 of those social media venues.